61-year-old Barry Rogers knows firsthand the power of TeleStroke technology.
I believe TeleStroke saved my life.
On February 11, 2016, Barry Rogers started his day as he usually does by making a protein shake. But this morning was very different.
And when I reached my arm in the pantry, it felt like I got a shock. It startled me, and I pulled back. I said, whoa, what was that? And I opened the shake, and this is when I first noticed something was really wrong, was there's a scoop inside the shake. And I reached my hand inside, and I could not grab it. I started getting a sensation of a tingling sensation throughout my body. I called my wife. I said, "Hun," and she's with her back to me. She said, "What?" And after that, I could not talk anymore. And she turned around and faced me. She said, "What?" And I just looked at her. And she said, "Stop playing. Come on, I have things to do." "What?" And all I could do was grunt. She said, "Are you having a stroke?"
Barry's wife immediately called 911, and paramedics in the ambulance activated TeleStroke technology to connect with stroke neurologist Dr. Gary Belt.
And then they explained to me, "Barry, we have this technology. The doctor's going to be treating you in the emergency room. He's going to talk to you right now over this monitor."
Dr. Belt was able to begin assessing Barry's condition en route to Overlook Medical Center.
All doctors to the ER.
I was able to evaluate him en route to the hospital. Well before he arrived at the hospital, I knew he was having a very large stroke. I knew exactly what I was going to do upon arrival.
Within 14 minutes of Barry's arrival at Overlook, the stroke center team administered TPA, a clot-busting drug which dissolved Barry's clot.
As soon as he hit the emergency room, he was in CAT scan within 2 to 3 minutes, back in the emergency room soon after, and within 14 minutes, he received TPA. All told, he probably got TPA less than 1 hour from the onset of his symptoms.
Without TeleStroke, how long would that have taken? You would have had to wait for him to arrive before you start any kind of treatment or evaluation.
Well, to give you an idea, nationally, we consider it good if we can get patients TPA within 60 minutes of hitting the emergency room. But if we're losing brain cells every minute, 2 million brain cells every minute, time is brain. So it was very important to get him treated as quickly as we could, and 14 minutes is a good time.
As a result, he regained speech and movement in his arms and legs.
How many?
3,
Now?
4, 2.
Excellent, okay.
Exercise I was doing prior to the stroke.
Which is?
Low intensity, basically, but probably the most intense thing I do is walking the golf course.
And Barry made a miraculous recovery. His follow-up studies were completely normal. He had no deficits. If TPA was not administered, there was the potential that Barry would have been unable to talk, unable to move the right side of his body, and have to live in a nursing home for the rest of his life.
They were ready. And then I learned later on that this technology with the monitor in the ambulance and the protocol that Dr. Bell took me through indicated exactly what stage or level of the stroke that I was in. And then there was communication to the staff in there, and they were ready.
Today, just 3 short months after his stroke, Barry is back out on the golf course.
I am forever in their debt. I felt I was being taken care of. The fact that I lived 20 minutes away from Overlook and their stroke center, and I think that was divine.
Dr. Gary Belt predicts that telemedicine will continue to gain momentum as a powerful tool in treating patients.
TeleStroke and telemedicine is revolutionizing medicine, again, supplying quality care at a very quick period of time to remote places that normally wouldn't have that degree of care.